Hi, I'm Dr. Michael Walsh. This week, we're going to continue our conversation about lumbar stenosis. Now, in the last video, we used the analogy of a tunnel with a speed bump and a thickened roof to describe the tunnel of the spinal canal and a bus trying to get through that tunnel as an example of the spinal cord and the nerve roots. Today, we're going to start talking a little bit about treatment. Let's have another look at our tunnel.
In some ways, it might actually be easier just to remove the roof of the tunnel. This would allow the bus to get through, even if that speed bump is still in place. This is a similar concept to one of the more common procedures for spinal stenosis called a laminectomy. But before we talk about a laminectomy, let's talk a little bit about why stenosis happens in the first place. In the back part of the spine, there are a series of joints. Along with the discs, these allow for some normal motion of the spinal column. However, as the discs and joints wear out, there may be a tendency for the bones to slip forward and pinch the spinal cord of the nerves. Obviously, this could cause some major problems, so the body tries to defend against this. One of the ways the body tries to stop this is by creating thickened ligaments around these joints. As you can see, sometimes if these ligaments get too thick, they can also cause problems and compress the spinal cord of the nerves. If it's severe enough to require surgery, a lot of times what we will do is make a small incision in the lower back and go in and essentially remove the roof, much like we did for the tunnel in the previous example. This can provide just enough space that the spinal cord and the nerve roots can re-expand and symptoms can be relieved. However, if you think about this fundamentally, we're in some ways counteracting what the body has done to stabilize a diseased joint. In one of our future videos, we'll discuss what happens when instability occurs. I hope you've enjoyed this video. If you have, please leave it a like, and don't forget to subscribe to this channel. Also, check out the other videos in this series. As always, I'm Dr. Michael Walsh. See you next time.